Common health problems in dogs. The learning outcomes for this lesson is what makes a condition to be considered common, memorising techniques, categorising health conditions, and common canine health conditions including the symptoms, diagnosis, and how the condition may affect the grooming process. A health condition is generally classed as common based on several key factors. The prevalence rate, so if a significant percentage of a population is affected, the condition is considered common. For example, a condition affecting more than 1% of the population is often regarded as common in veterinary medicine. The frequency of the diagnosis. If a vet diagnoses the condition regularly in practice, it is likely considered common. Conditions seen multiple times per week in clinics like hip dysplasia or obesity are considered widespread. Breed-specific risks. Some conditions are not common in all dogs but are very common within certain breeds, for example, elbow dysplasia in Labrador Retrievers or hip dysplasia in German Shepherds. If a large percentage of a breed suffers from a condition, it may be classed as common within that breed, even if it is less common across all dogs. The impact on the population. If a condition significantly affects quality of life for many dogs, it may be considered common, even if the percentage of affected dogs is lower. For example, elbow dysplasia affects around 0.6% of UK dogs, which may seem low, but because it has a serious impact on mobility, it is still considered a common orthopaedic issue in large breeds. And heritability and spread. If a condition is inherited and continues to appear across generations, it remains a persistent issue in the population. If it spreads, for example, contagious diseases like kennel cough, it may also be classed as common. To ensure you remember key facts about each condition, we recommend using memorising techniques. Note-taking can help you to break down information and digest it in chunks, which lends itself to chunking, another method of memorising facts. Assigning a visual to a memory can help you recall it. Drawing a doodle. Use a single piece of paper on a table and draw some simple shapes or lines to create a doodle. Movement will also help you to memorise the facts by increasing your pulse and sending oxygen to your brain, so regularly get up and move around, do chair yoga while you watch, or take a walk and just listen to the audio. We're going to categorise these following health conditions into either a disease, a disorder, or a disability. The definition of disease is a disorder of structure or function in a human, animal, or plant, especially one that has a known cause and a distinctive group of symptoms, signs, or anatomical changes. A disorder is an illness or condition that disrupts normal physical or mental functions. A disability is a physical or mental condition that limits a person's movements, senses, or activities. Canine parvovirus is a disease that is viral in origin. The virus is highly contagious and is primarily spread through contact with infected feces, contaminated surfaces such as kennels, food bowls, and grooming equipment, or direct contact with an infected dog. The virus can survive in the environment for months, making it easily transmissible. Common symptoms include severe vomiting, diarrhea, which might often be bloody, lethargy, fever, loss of appetite, and dehydration. Parvovirus is life-threatening, especially for puppies and unvaccinated dogs. It can lead to extreme dehydration, sepsis, and without prompt treatment, death. Treatment for parvovirus usually requires hospitalization, as it involves intensive care to manage dehydration, secondary infections, and electrolyte imbalances. At home or in a salon, isolating infected animals and thoroughly disinfecting the environment is crucial to prevent spread. Prevention is primarily through vaccination, especially in puppies, as well as maintaining strict hygiene protocols in environments where dogs congregate. Avoiding contact with unknown dogs, especially if unvaccinated, is also key. Canine parvovirus is not zoonotic and does not spread to humans. How long can parvovirus survive in the environment? The answer is months. Canine distemper is a disease and is viral in origin, caused by the canine distemper virus, CDV. The virus spreads through respiratory droplets when an infected dog coughs or sneezes, as well as through contact with contaminated surfaces or bodily fluids, including saliva, urine, and feces. It is highly contagious among unvaccinated dogs. Symptoms often start with fever, nasal discharge, eye discharge, coughing, lethargy, loss of appetite, and gastrointestinal symptoms like vomiting and diarrhea. As it progresses, it can affect the nervous system, causing seizures, muscle twitching, and paralysis. Distemper is potentially fatal, especially in young or unvaccinated dogs. It can cause severe neurological damage and permanent disability in dogs that survive the disease. There is no cure, so treatment focuses on supportive care to manage symptoms, prevent dehydration, and address secondary infections. At home or in a salon, infected animals should be isolated and all surfaces should be disinfected. Care should be taken to avoid stress, which can exacerbate the symptoms. Vaccination is the most effective prevention against distemper. Maintaining good hygiene practices and minimizing contact with unknown dogs, especially in public places, can help reduce exposure risk. Canine distemper is not zoonotic and does not spread to humans. How is CDV spread? Did you get it right? The answer is via respiratory droplets. Leptospirosis is a disease and is bacterial in origin, caused by various strains of the bacteria Leptospira. The bacteria are typically spread through contact with contaminated water, soil, or urine from infected animals, including wildlife like rats. Dogs can contract it by drinking, swimming in, or walking through contaminated water. Symptoms may include fever, muscle tenderness, vomiting, diarrhea, loss of appetite, jaundice, increased thirst, and lethargy. In severe cases, it can cause kidney and liver failure. Leptospirosis may lead to permanent organ damage or death. Treatment usually involves antibiotics and supportive care for hydration and organ function. Isolation of infected dogs and strict disinfection of the environment is important in a home or salon to prevent spread, especially where water or urine could come into contact with other animals. Prevention includes vaccination and limiting exposure to contaminated water sources, especially in high-risk areas. Good hygiene practices and pest control also help minimize risk. Leptospirosis is zoonotic and can spread to humans, where it may cause flu-like symptoms or serious illness, particularly affecting the liver and kidneys. How can dogs become infected with leptospirosis? The answer is by coming into contact with contaminated soil, water, or infected urine. Canine parainfluenza is a disease and is viral in origin, caused by the canine parainfluenza virus, CPIV. The virus spreads through airborne respiratory droplets when infected dogs cough or sneeze. It is highly contagious, particularly in areas where dogs are in close contact, such as boarding kennels, grooming salons, and shelters. Symptoms typically include coughing, nasal discharge, sneezing, and sometimes fever and lethargy. It is one of the main contributors to kennel cough, a highly contagious respiratory infection complex. Parainfluenza itself is generally not life-threatening, but it can weaken the immune system and lead to a secondary bacterial infection, which can be more serious. In puppies, elderly dogs, or dogs with compromised immune systems, symptoms may be more severe. Treatment is supportive and may include cough suppressants, rest and fluids. In a salon, affected dogs should be isolated to prevent spreading the virus. All surfaces and grooming tools should be disinfected to minimize the risk to other dogs. Vaccination is available and often included in combination vaccines. Maintaining good air circulation, reducing stress, and practicing good hygiene in environments with many dogs can also help prevent its spread. Canine parainfluenza is not zoonotic and does not spread to humans. What should you do if you have groomed a dog that may have been infected with CPIV? The answer is clean all surfaces with a broad spectrum disinfectant like Verconess and aerate the salon. Kennel cough is the common term for infectious tracheobronchitis, ITB, and it's a disease that infects the upper respiratory tract. Kennel cough can have multiple causes. The most common cause is the bacterium Bordetella bronchoseptica, but it can also be caused by viruses such as the canine parainfluenza virus. Kennel cough is highly contagious and spreads through respiratory droplets when infected dogs cough or sneeze. It can also spread via contaminated surfaces like water bowls, toys and grooming tools, making places with close dog contact, such as kennels, salons and parks, high-risk environments. The main symptom is a persistent honking cough that can sound like a goose honk. Other symptoms may include sneezing, runny nose, eye discharge and occasionally fever and lethargy. Kennel cough is generally mild but can develop into pneumonia in puppies, elderly dogs or immunocompromised dogs. Severe cases may require medical attention, but it is rarely life-threatening in otherwise healthy dogs. Mild cases often resolve on their own with rest and supportive care, though vets may prescribe cough suppressants or antibiotics for secondary infections. In a salon, infected dogs should be isolated to prevent spread, and all equipment and surfaces should be thoroughly disinfected. Vaccination is available for the Bordetella bacteria and some viruses associated with kennel cough. Good ventilation, hygiene practices, and minimizing close contact with unknown dogs can help reduce the risk in multi-dog environments. Kennel cough is rarely zoonotic, however, in rare cases, Bordetella bronchoseptica can infect people with weakened immune systems, so caution is advised around immunocompromised individuals. Dogs that have recently been vaccinated can shed the vaccine strain of the bacteria, which can infect humans with weakened immune systems, such as pregnant women and/or people receiving chemotherapy treatment. Why do you need to know if your client's dog has recently had a kennel cough vaccine? The answer is because the vaccine is a live vaccine and sheds for several weeks after administration, potentially putting people with weakened immune systems at risk. Chondrodysplasia is a disorder and can be considered a disability depending on its severity. It's a skeletal disorder affecting cartilage and bone development, often leading to disproportionate limb growth. Chondrodysplasia develops as a result of specific genetic mutations affecting cartilage growth. It is inherited from parents and passed down through generations in affected breeds like Dachshunds, Basset Hounds and Corgis, which have therefore shorter legs due to this condition. Symptoms include short-bowed limbs, abnormal limb alignment, joint pain, and possible difficulty walking or running. In some cases, it can lead to early-onset arthritis or other joint issues. While many dogs with chondrodysplasia live relatively normal lives, they may be at higher risk of joint pain, arthritis, invertebral disc disease, and other musculoskeletal problems, especially as they age. Management involves supportive care such as weight management, low-impact exercise, and providing joint support supplements as recommended by a vet. In a salon, care should be taken with handling, lifting, and grooming to avoid putting stress on joints. Since it's genetic, prevention involves selective breeding practices to avoid propagating the condition. Prospective dog owners should research the breed predispositions and consult with breeders about health testing. Groomers must adapt their handling and restraint techniques to ensure the dog's comfort and safety while reducing the risk of injury. The handling adjustments should include supporting the spine. Always support the dog's back when lifting or positioning them to prevent unnecessary strain. Avoid excessive bending or twisting. Work close to the ground or on a lower table to prevent accidental falls or jumping, which can injure their delicate spines. When lifting or restraining limbs for grooming, avoid overextending their joints as they may be more prone to discomfort or injury. Ensure the grooming table or bath has a rubber mat to provide stability and prevent slipping. If using a grooming noose, keep it loose enough to prevent strain but secure to prevent sudden movement. Avoid suspending the dog in any way that might put pressure on their spine. Always lift with support under the abdomen and hindquarters to distribute their weight evenly. Be mindful when brushing or clipping near the joints, as chondrodysplastic breeds may have arthritis or joint sensitivity. Allow the dog to rest periodically during the groom, especially if they show signs of discomfort. Use slow, gentle movements to reduce stress and keep the grooming session positive. When clipping the armpit areas, have the dog stand at the edge of the table so you can get the clippers underneath them without overstretching their limbs. Why is it important to keep keep the spine straight and supported when lifting a chondrodysplastic dog? The answer is because their long backs and short legs make them prone to spinal injuries such as invertebral disc disease. Lifting without proper support can put excessive strain on the spine, increasing the risk of slipped discs, pain or even paralysis. Supporting both the chest and hindquarters helps evenly distribute weight properly and prevents unnatural bending or twisting of the spine. Brachycephaly is a disorder and sometimes is considered a disability depending on the severity. It is a genetic condition characterized by a shortened skull shape, which affects the respiratory system and facial structure. Brachycephaly is genetic in origin and is not caused by an infectious agent. It is a trait selectively bred into certain dog breeds, such as bulldogs, pugs, shih tzus, and French bulldogs. Brachycephaly develops due to selective breeding practices that favor short, flat skull shapes. The condition is inherited genetically from parent to offspring. Common symptoms include breathing difficulties, snoring, excessive panting, intolerance to heat, frequent respiratory infections, and in severe cases, obstructive breathing. Dogs with this condition may have a compromised airway, leading to a range of issues known as brachycephalic obstruction airway symptoms, BOAS. Brachycephalic dogs are at a higher risk for heat stroke, respiratory distress, and complications from exercise or stress. They may also be prone to dental crowding, skin fold infections, and eye injuries due to their skull shape. Management includes avoiding strenuous exercise, maintaining a cool environment, and minimizing stress. In salons, gentle handling, avoiding overexertion, and keeping grooming sessions calm and cool are essential. Severe cases may require surgery to improve airway function. Prevention would involve responsible breeding practices that avoid excessively flat-faced breeding and promote healthy functional conformation. Owners can consult breeders who prioritize health over extreme physical traits. Clearly, it is not zoonotic and would not affect a human. Why is it important to use a harness instead of a noose when grooming a brachycephalic dog? The answer is, a grooming noose around the neck can put pressure on the trachea, restricting airflow and increasing the risk of breathing distress or collapse, as well as overheating and stress, which can further exacerbate their breathing problems. A harness distributes restraint more evenly across the chest and body, reducing strain on the airways and ensuring a safer, more comfortable grooming experience. Sarcoptic mange is also known as scabies, and it's a disease caused by an infestation of the Sarcoptes scabii mite. The mite spread through direct contact with an infected animal or contaminated objects like bedding, grooming tools, or surfaces. Sarcoptic mange is highly contagious among dogs. Symptoms include intense itching, redness, hair loss, skin inflammation, sores, and crusty patches on the skin, especially around the ears, elbows, and belly. Secondary infections can develop due to scratching. If left untreated, sarcoptic mange can lead to severe skin infections, weight loss, and overall poor health. The intense itching and discomfort can also impact the dog's quality of life. Treatment typically involves medicated baths, topical treatments, or oral medications to kill the mites at home. It's crucial to disinfect all surfaces, bedding, and grooming tools to prevent reinfestation or spread to other animals. Prevention includes regular vet checkups, avoiding contact with infected animals, and maintaining good hygiene in shared spaces. Some flea and tick preventatives may also offer protection against mites. Sarcoptic mange is zoonotic, and the Sarcoptes scabii mites can cause a mild, temporary skin reaction in humans, such as itching and redness, but they do not typically reproduce on human skin. Canine demodicosis, also known as demodetic mange, is a disease caused by a parasitic mite infestation. Canine demodicosis is parasitic in origin, caused by the Demodex canis mite, which normally resides in the hair follicles in dogs. Demodex mites are typically passed from mother to puppies shortly after birth. Most dogs have a small population of these mites without issue, but the disease develops if the dog's immune system is weakened, allowing the mites to multiply excessively. Symptoms include hair loss, especially around the eyes, mouth and legs, along with red scaly skin. In severe cases, the skin may become thickened, swollen and infected with additional symptoms like itchiness and discomfort. While not usually life-threatening, untreated demodicosis can lead to secondary bacterial infections, skin inflammation and severe discomfort, particularly if it progresses to a generalized form. Treatment often includes medicated shampoos, topical treatment or oral medications to reduce mite populations and support immune health. In the salon, minimizing stress for affected dogs and disinfecting grooming equipment after use are essential to prevent any risk of secondary infection. Prevention involves maintaining a healthy immune system, as dogs with robust immune systems typically keep mite populations under control. Regular vet checkups and prompt treatment of skin issues can also help. Canine demodicosis is not zoonotics, and Demodex mites are species-specific, meaning they cannot infest or cause issues in humans. Unlike sarcoptic mange, demodectic mange is not zoonotic. True or false? The answer is true. Lyme disease is a disease caused by a bacterial infection. It's transmitted through the bite of an infected tick, primarily the black-legged tick, which carries the bacteria. The bacteria are transmitted to the dog during the tick's feeding process. Around 4% of tick bites to humans in the UK lead to Lyme disease, and it is more prevalent in southern England and the Scottish Highlands. Ticks become carriers of Lyme disease if they feed off an infected animal such as mice. The bacteria then enters the tick's digestive system and passes on to their next life cycle. They will then infect the next animal or human they bite. Removing the tick promptly can reduce the risk of becoming infected. Symptoms of Lyme disease in dogs include fever, lameness, often shifting between limbs, joint swelling, loss of appetite, lethargy, and in some cases, kidney problems. Some dogs may show no symptoms at all. If left untreated, Lyme disease can lead to chronic joint problems, kidney damage, and long-term health issues. The disease can be serious, especially if it affects the kidneys. Treatment typically involves a course of antibiotics to kill the bacteria. Pain relief and anti-inflammatory medications may be prescribed for joint pain. In the salon, reducing tick exposure by checking for ticks after outdoor activities and maintaining a clean environment is crucial to preventing tick bites. Prevention includes tick control measures like using tick preventatives, checking for ticks after outdoor activities, and avoiding tick-infested areas. Vaccination may also be considered in regions where Lyme disease is common. Lyme disease is zoonotic. Tick bites can lead to Lyme disease in both dogs and humans, so precautions should be taken to prevent tick exposure. This is a female tick that was removed from a dog and wrapped in sellotape so she suffocates and dies, and to prevent any eggs contaminating the environment. You can tell she's female because she has a small shield which allows her body to expand as she feeds. We can tell she's an adult because she has 8 legs, which means once she had had her fill of blood, she would have dropped off and laid over 2,000 eggs in the environment. Do all tick bites cause Lyme disease? The answer is no. Not all ticks carry Lyme disease, and dogs may not develop Lyme disease even if they are bitten by an infected tick. Regular tick prevention and prompt removal of ticks are key to reducing the risk of Lyme disease. The canine endocrine system is a complex network of glands that produce hormones to regulate essential bodily functions, including metabolism, growth, reproduction, and stress responses. Key glands include the pituitary gland, often referred to as the master gland, which controls other endocrine glands and releases hormones like growth hormones. The thyroid gland regulates metabolism through the production of thyroxine, while the parathyroid glands help maintain calcium balance. The adrenal glands produce cortisol and adrenaline, which are crucial for stress response and energy regulation. The pancreas plays a dual role, producing insulin and glucagon to control blood sugar levels. The reproductive glands, ovaries in females and testes in males, secrete sex hormones that influence development and reproductive functions. This intricate system works through a delicate balance of hormone release and feedback mechanisms, ensuring that the body maintains homeostasis. Hypothyroidism is a disorder caused by an underactive thyroid gland that does not produce enough thyroid hormones. The thyroid gland is located in the neck near the larynx and just in front of the trachea. Hypothyroidism is one of the most common endocrine disorders in dogs. It is most commonly caused by an autoimmune disease, where the immune system attacks the thyroid, or it can be caused by thyroid gland atrophy or a tumour. Hypothyroidism is not contagious or zoonotic. It develops due to a failure of the thyroid gland to produce adequate levels of hormones. It is commonly seen in middle-aged to older dogs, and certain breeds are predisposed, such as golden retrievers and cocker spaniels. It can also be caused by thyroid gland destruction due to other factors, such as cancer or radiation therapy. Symptoms include lethargy, weight gain, cold intolerance, thinning or dull coat, hair loss, skin infections, slow heart rate, and changes in the dog's behaviour, such as increased irritability or depression. In severe cases, it can lead to seizures or a coma, though these are rare. If untreated, hypothyroidism can lead to cardiovascular problems, neurological issues, and a weakened immune system, increasing the risk of secondary infections. In severe cases, it can result in a coma, a life-threatening condition where the dog goes into shock due to extreme hormone deficiency. Treatment typically involves lifetime thyroid hormone replacement, usually in the form of synthetic tablets. Treatment helps to manage symptoms and improve the dog's quality of life. Regular vet checkups are essential to monitor hormone levels and adjust medication doses as needed. In a salon, dogs with hypothyroidism should be handled gently, as they may have dry or thin skin and their energy levels may be lower. Grooming should avoid excessive stress or prolonged physical exertion. Prevention of hypothyroidism is not possible, as it is often genetic or idiopathic with no known cause. However, regular vet checkups can help catch the disease early and start treatment before complications arise. There are no known preventative measures for autoimmune thyroiditis. Cushing's disease is, as the name suggests, a disease and is typically caused by the overproduction of cortisol, a hormone produced by the adrenal glands. This can happen due to either a tumour in the pituitary gland or a tumour in the adrenal glands. Cushing's disease does not spread between animals. It develops over time due to either a benign tumour in the pituitary gland, which causes a release of too much hormone, or an adrenal gland tumour that directly overproduces cortisol. It most commonly occurs in middle-aged to older dogs, and some breeds are more predisposed. Another cause could be as a result of high doses of steroid medication. Symptoms include excessive thirst, increased urination, increased appetite, panting, lethargy, muscle weakness, hair loss, and a pot-bellied appearance. Some dogs may also develop skin issues such as thinning skin, bruising, and slow healing wounds. Cushing's disease can lead to complications like high blood pressure, diabetes, kidney disease, and increased susceptibility to infections. If left untreated, it can significantly impact the dog's quality of life and lead to serious complications, including an increased risk of blood clots and organ damage. Treatment typically involves medication to control cortisol production or surgery to remove a tumour if one is present. In some cases, radiation therapy is used to treat pituitary tumours. At home, managing the disease requires regular vet checkups and blood tests to monitor hormone levels. In a salon, it's important to be gentle with affected dogs, as their skin is often fragile and they may have less energy than usual. There is no known way to prevent Cushing's disease, as it is often caused by spontaneous tumour growth or is related to aging. Regular vet checkups, especially in older dogs, can help catch the disease early and begin management. Addison's disease, also known as hypoadrenocorticism, is a disorder of the adrenal glands whereby the glands aren't functioning correctly and are failing to produce sufficient hormones, the opposite of Cushing's disease. It develops when the adrenal glands fail to produce enough cortisol and aldosterone, which are essential for regulating metabolism, stress responses, and electrolyte balance. The exact cause is often unknown, but it is believed to be autoimmune in nature, and genetic factors may play a role in some breeds. It is thought that some cases could be caused by trauma or tumours of the pituitary gland. Symptoms include lethargy, vomiting, diarrhea, weight loss, excessive thirst or urination, and a poor appetite. Some dogs may experience episodes of severe crisis, which can include shock, collapse, and low blood pressure. Shock is life-threatening and must be treated immediately with emergency first aid and vet treatment. Addison's disease can be life-threatening, especially if the dog goes into an Addisonian crisis, acute adrenal insufficiency, which requires immediate medical attention. Chronic management is necessary to prevent life-threatening complications such as dehydration, shock, and electrolyte imbalances. Treatment typically involves hormone replacement therapy, as well as monitoring for signs of crisis. In a salon, affected dogs should be treated gently, as stress or overexertion could trigger a crisis. Regular vet visits are necessary to adjust medication dosages and monitor the dog's condition. There is no known way to prevent Addison's disease, as it is largely genetic and autoimmune in nature. Early diagnosis and management can help improve the dog's quality of life and prevent crisis episodes. An Addisonian crisis is a life-threatening emergency that occurs when a dog with Addison's disease experiences a sudden, severe imbalance in electrolytes or hormone levels. It's often triggered by stress, illness, insufficient cortisol and aldosterone production by the adrenal glands, or a lack of medication if a dog has recently been diagnosed or a dose of medication has been missed. Signs and symptoms include vomiting and diarrhea, weakness and lethargy, collapse, shock, low blood pressure, dehydration, severe weakness and tremors. Immediate veterinary care is crucial. Have the owners of dogs with Addison's stay nearby so they can administer fluids and electrolytes to stabilize the dog in the event of a crisis. Hormone replacement therapy to support the adrenal glands is required by a vet. Prevention includes regular medication as prescribed by the vet, stress management and a calm environment, frequent checkups to monitor the health and electrolyte levels as well. Handling and adapting to a dog with Addison's disease requires extra care and attention during grooming, as this condition affects the adrenal glands, leading to a lack of crucial hormones like cortisol. Here are some steps a groomer should take. Understand the dog's condition. Before grooming, ensure the dog's condition is stable. Addison's disease can cause symptoms like weakness, vomiting, diarrhea or lethargy, especially during times of stress. Check for any signs of illness or distress before beginning the grooming session. Minimize the dog's stress throughout the grooming session. Dogs with Addison's can be more sensitive to stress, so it's important to keep the environment calm and quiet. Avoid loud noises, sudden movements, or rapid changes in temperature. Maybe even book the dog on a one-on-one basis. Take breaks if the dog seems anxious or tired. Gentle handling is key. Avoid putting too much pressure on the dog during grooming, especially around sensitive areas. Monitor the dog's health throughout. Watch for signs that the dog might be experiencing an Addisonian crisis, which can include vomiting, lethargy, weakness or tremors. If these signs occur during grooming, it's important to stop the session and inform the dog's owner immediately. Work in short sessions. If the dog becomes stressed easily, break the grooming into shorter sessions. Focus on one area at a time, such as brushing the coat or trimming the nails, and take frequent breaks to avoid overwhelming the dog. Communicate with the owner. Make sure to ask the owner if the dog is on any specific medications or if there are any special instructions for handling the dog due to its condition. The owner might provide advice about their dog's medication or special care needs during grooming. Hydration. Dogs with Addison's disease can sometimes become dehydrated, so ensure fresh water is available during the grooming session. Dehydration can exacerbate symptoms, so keeping the dog well hydrated is important. Avoid overheating. Since Addison's disease can affect the dog's ability to regulate body temperature, be cautious of overheating. Ensure the grooming area is cool and well ventilated, especially if you are using heated tools. Post-grooming care. After the grooming session, check in with the owner to ensure the dog is doing okay. Some dogs may need rest following a grooming session, especially if it was a longer or more intense session. By maintaining a calm, patient and informed approach, groomers can help ensure the safety and comfort with dogs with Addison's disease while providing the grooming services they need. Addison's disease is a disorder of which glands? The answer is the adrenal glands. A dog's nervous system is a complex network that controls bodily functions, movement and responses to stimuli. It is responsible for processing sensory information, coordinating actions, and regulating vital functions like breathing and heartbeat. The nervous system is divided into two main parts. The central nervous system consists of the brain and spinal cord and acts as the command center of the body. The brain processes information, controls thoughts, emotions, movement, and automatic functions like breathing and heart rate. The spinal cord transmits signals between the brain and the rest of the body, enabling movement and reflexes. The peripheral nervous system connects the CNS to the rest of the body and is divided into two parts. The somatic nervous system, which is voluntary control and controls conscious movement such as walking or wagging a tail. The autonomic nervous system, which is involuntary control, regulates automatic body functions like heartbeat, digestion, and breathing. It is further divided into sympathetic nervous system, which triggers the fight or flight response in stressful situations, and the parasympathetic nervous system, which promotes relaxation and recovery, helping maintain normal bodily functions. Together, these systems allow dogs to think, move, feel pain, and respond to their environment. Chiari-like malformation, CM, is a structural abnormality where the skull is too small to accommodate the brain, leading to compression and displacement of brain tissue at the base of the skull. This condition often results in the herniation of the cerebellum into the spinal canal, disrupting cerebrospinal fluid (CSF) flow and potentially causing syringomyelia (SM), a painful condition characterized by fluid-filled cavities in the spinal cord. Chiari malformation in dogs is primarily a congenital condition, meaning it is present at birth. It is most commonly seen in brachycephalic and toy breeds, such as Cavalier King Charles Spaniels, Griffon Bruxellois, and Chihuahuas. Selective breeding for smaller skulls has contributed to the prevalence of CM. While genetics play a significant role, the exact mechanisms of skull development abnormalities remain under study. Symptoms of CM can vary depending on severity, but may include persistent scratching, often around the neck and shoulders, sensitivity or pain in the neck, head or back, weakness or unsteady gait called ataxia, reluctance to be touched around the head or neck, yelping and crying out in pain for no obvious reason, head shaking or tilting, and seizures in severe cases. Many dogs with mild CM show no symptoms, but as the condition progresses, they may develop increasing discomfort and neurological issues. Treatment depends on the severity of the symptoms. Adjustments, such as using a harness instead of a collar to avoid neck pressure and keeping the dog comfortable and avoiding activities that exacerbate the symptoms. Vets may prescribe pain relief to manage discomfort, medication to reduce cerebrospinal fluid production, and to reduce inflammation. In severe cases, surgery may be performed to remove part of the skull and improve CSF flow. This is a high-risk procedure with varying success rates. Since CM is primarily hereditary, the best prevention method is responsible breeding. Ethical breeders should screen breeding dogs for CM through MRI scans and avoid breeding dogs diagnosed with moderate to severe CM. Select for healthier skull structures rather than exaggerated breed features. While genetic testing and MRI screening can reduce the risk, they do not completely eliminate the possibility of passing CM to offspring. So what should a dog groomer do if they think a client's dog has Chiari malformation? As a dog groomer, recognizing potential signs of CM is important, but diagnosis must be left to a vet. If you suspect a dog may have CM, consider the following steps. Handle the dog carefully, avoiding excessive pressure on the neck and head. Observe the dog's behavior throughout the groom. If the dog yelps, resists handling, or exhibits neurological signs such as unsteadiness or phantom scratching, take notes. Communicate with the owner. Politely inform the owner if you notice unusual pain responses or behaviors and prompt veterinary attention. Encourage the owner to seek vet advice for a proper diagnosis if the symptoms persist or if they haven't done so already. What is the main cause of Chiari malformation? The answer is congenital skull malformation that results in the skull being too small to accommodate the brain. Syringomyelia is a disorder and often considered a disability due to its impact on the nervous system. It is a neurological condition that occurs when cavities or cysts, called syrinxes, form within the spinal cord, often near the brainstem. As the syrinx grows, it can put pressure on the surrounding nerve tissue, causing damage to the spinal cord. This can disrupt normal nervous system function, and over time, the syrinx can cause degeneration of the spinal cord. Syringomyelia is often genetic and typically occurs secondary to Chiari-like malformation, which causes a disruption of normal cerebrospinal fluid flow, leading to the formation of syrinxes. It is most commonly seen in Cavalier King Charles Spaniels, though other breeds can be affected as well. The pressure from the syrinx can interfere with nerve signals, leading to symptoms such as pain that is often expressed as yelping or sensitivity when touched, discomfort, weakness, difficulty walking, problems with coordination, scratching at the neck, head or ears due to the pain, loss of sensation, and in severe cases, paralysis. The pain can be chronic and may worsen with time. Syringomyelia can lead to progressive neurological damage, chronic pain, and a reduction in the dog's quality of life. If left untreated, it can result in more severe neurological deficits, including loss of motor function and chronic pain. In extreme cases, it can be fatal. Treatment often involves pain management through medication, such as analgesics and anti-inflammatory drugs, to reduce discomfort and inflammation. Surgery may be an option in some cases, particularly if the condition is severe. In a salon, care should be taken to avoid stress and neck manipulation, as this can exacerbate symptoms. Gentle handling and avoiding any activity that may cause pain are essential. Since syringomyelia is often hereditary, prevention typically involves responsible breeding practices, avoiding breeding dogs with the condition or those with a known predisposition to Chiari-like malformation. Early diagnosis and management can help slow progression in affected dogs. Always be aware of the signs of syringomyelia pain or distress, such as changes in posture, tremors, or vocalization. If you notice these, stop grooming immediately and seek veterinary help if necessary. Handle the dog gently, and if the dog's ears are affected by the condition, as some dogs may experience additional issues like ear pain, avoid unnecessary pulling or manipulation. Dogs may be less aware of their limbs due to nerve damage, so make sure they feel safe and comfortable, and consider using a mat, such as a non-slip yoga mat, on the table to assist them. Support the dog's body to prevent sudden movements or jerks that could worsen any nerve damage or pain, and be mindful of how you position the dog during the grooming, and be extra careful when grooming the neck, head and spine. How should you adapt your restraints when grooming a dog with syringomyelia? The answer is, use a harness rather than a noose, and be extra gentle around the neck, head and spine. Rabies is a disease caused by a viral infection affecting the nervous system. Rabies is primarily spread through the saliva of infected animals, most commonly via bites. The virus enters the body through broken skin or mucous membranes and travels to the brain, where it causes inflammation and neurological damage. Rabies can be transmitted by any mammal, though in many parts of the world it is most commonly spread by wild animals like raccoons, bats, foxes and skunks. In the UK, it is only found in bats. Early symptoms include changes in behaviour, such as agitation, aggression or excessive drooling, fever, lack of coordination, weakness, paralysis and difficulty swallowing. As the disease progresses, it leads to seizures, paralysis, and eventually death due to respiratory failure. In some cases, dogs may exhibit a dumb or paralytic form where they are lethargic and non-reactive. Rabies is almost always fatal once symptoms appear. It attacks the central nervous system, leading to irreversible neurological damage and death. It is a significant public health risk because it can be transmitted to humans, and once clinical signs are visible, the disease is nearly always fatal in both animals and humans. There is no treatment for rabies once symptoms appear. Rabies is a preventable disease, though, through vaccination, and this is the primary form of management. If a dog is suspected of having been exposed to rabies, immediate quarantine and observation are necessary. In the salon, handling dogs at risk of rabies should be avoided until proper veterinary evaluation and vaccination status are confirmed. Handling animals with suspected rabies should be done with caution, using protective equipment if necessary. The primary method of prevention is vaccination. Dogs should receive rabies vaccinations as required by law in many areas, and booster shots should be given periodically. Avoiding contact with wildlife and unfamiliar animals is also crucial in reducing exposure risk. Rabies is zoonotic. The virus can be transmitted from infected animals to humans, typically through bites or scratches. Rabies is fatal in humans once symptoms appear, but it can be prevented with prompt post-exposure treatment, such as a series of rabies shots, if administered before symptoms develop. What part of the body does rabies attack? The answer is the central nervous system. Epilepsy is a disorder of the brain that causes recurrent seizures. In dogs, epilepsy is typically classified into two types: idiopathic epilepsy, where no underlying cause is found, and symptomatic epilepsy, where seizures are caused by a known factor, such as a brain tumor, head trauma, or infection. Epilepsy often has a genetic component, especially in idiopathic epilepsy, in which certain breeds are predisposed, such as Border Collies, Beagles, and German Shepherds. Symptomatic epilepsy can develop due to external factors, such as a brain injury, tumours, infections, or metabolic disorders. Symptoms of epilepsy are seizures, which may range from mild, where you might see staring, drooling, or twitching, to severe, where you might see violent shaking, falling, or loss of consciousness. Seizures can last from a few seconds to several minutes and may occur in clusters. Between seizures, dogs may appear normal, but some may experience behavioural changes such as confusion or temporary disorientation. Seizures, if not controlled, can lead to long-term neurological damage, injury during a seizure, and a decrease in quality of life. Status epilepticus is a prolonged seizure lasting for more than 5 minutes or multiple seizures in a row without recovery in between, and that is a medical emergency and can be life-threatening. Frequent seizures can also put strain on the cardiovascular and respiratory systems. Treatment for epilepsy often involves anti-seizure medications to reduce the frequency and severity of seizures. The goal of treatment is to achieve seizure control without causing significant side effects. At home, managing epilepsy involves maintaining a safe environment and monitoring for signs of seizures. In a salon, it's important to avoid stressful situations and provide a calm and controlled environment for dogs with epilepsy. If a seizure occurs, removing stimuli and keeping them away from dangerous objects is crucial. Prevention of idiopathic epilepsy is not possible as it is often genetic, but managing the condition with medication can help prevent seizures. In cases of symptomatic epilepsy, preventing the underlying cause, such as treating the infection, tumour, or brain injury, can help manage or reduce seizures. When grooming a dog with epilepsy, you should keep the environment calm with soft lighting, gentle handling, and minimal noise. Avoid excessive restraints as they can increase stress and trigger seizures. Instead, have a second handler to help with stability. In the event of a seizure, restraints can cause injury. Avoid flashing lights, strong scents, or loud noises, as they can sometimes trigger a seizure, and watch for early seizure indicators like excessive drooling, disorientation, or twitching. If a seizure occurs, start timing it. If it lasts over 5 minutes or occurs in clusters, call the owner or a vet immediately. If the dog has only recently been diagnosed, have the owner wait outside in case a seizure is triggered. What are some of the early signs that a seizure is imminent? The answer is excessive drooling, disorientation, or twitching. Luxating patella is a disorder in which the patella, which is the term for a kneecap, moves out of its normal position in the knee joint, often temporarily. This condition is also called patellar luxation. It is a mechanical and anatomical issue, often related to abnormal development of the femur, tibia, and patella, leading to misalignment or instability in the knee joint. Luxating patella is usually genetic and is most commonly seen in small and toy dog breeds such as Chihuahuas, Pomeranians, and Yorkshire Terriers. It can develop due to anatomical abnormalities such as shallow femoral grooves or trauma. It can be present at birth or develop later in life. Symptoms of a luxating patella include limping, skipping, or holding up the leg after walking or running, particularly after the kneecap pops out of place. In mild cases, the dog may show intermittent lameness, while in severe cases, the dog may have difficulty walking or experience pain when the knee is dislocated. Over time, the condition can lead to arthritis in the knee joint if untreated. If left untreated, luxating patella can lead to chronic pain, joint instability, and arthritis due to wear and tear on the joint. In severe cases, it can cause muscle atrophy, decreased mobility, and permanent lameness. Long-term damage to the knee joint may require surgical intervention. Treatment depends on the severity of the condition. Mild cases can be managed with anti-inflammatory medications, weight management, and joint supplements to support overall joint health. For more severe cases, surgery may be needed to realign the patella and stabilize the joint. In a salon, dogs with luxating patellas should be handled carefully, avoiding excessive jumping or strain on the knee joint. Gentle grooming, avoiding too much stress on the affected leg, and using ramps instead of stairs can help manage the condition. Prevention of luxating patella is not always possible, especially since it is often genetic. However, responsible breeding practices to avoid breeding dogs with this condition can help reduce its prevalence in certain breeds. Regular veterinary checkups can help catch the condition early and manage it before it worsens. How might you recognize signs of a luxating patella during a grooming session? The answer is, the dog may appear reluctant to have its hind legs handled, or it may suddenly lift a leg while standing. Hip dysplasia is a disorder of the hip joint where the ball and socket do not fit properly, leading to joint instability and over time arthritis. Hip dysplasia is genetic, often passed down to offspring from parents, especially in large breed dogs like German Shepherds, Labrador Retrievers and Great Danes. It can develop as the dog grows, particularly in the first year of life when the hip joint is still forming. Environmental factors such as rapid growth, obesity, or excessive exercise during puppyhood can contribute to its development. The condition worsens over time, especially if left untreated, as the joint becomes more unstable and develops arthritis. Symptoms of hip dysplasia include limping, difficulty standing up, stiffness after exercise, and a bunny hopping gait, where both back legs move together. Dogs may also show signs of pain when their hips are manipulated or when they climb stairs or jump. Over time, the condition can cause muscle atrophy in the hind legs and decrease mobility. Left untreated, hip dysplasia can lead to severe arthritis, chronic pain, and progressive disability. Over time, the wear and tear on the joint can significantly affect the dog's quality of life, making movement difficult or impossible. In severe cases, it can lead to the need for surgical intervention, such as a hip replacement or femoral head ostectomy. Treatment typically includes weight management, joint supplements like glucosamine, anti-inflammatory medications, and physical therapy to maintain joint mobility and reduce pain. In more severe cases, surgery may be needed. Dogs with hip dysplasia should be kept at a healthy weight to reduce strain on the joints, and low-impact exercise such as swimming can be beneficial. In a salon, grooming should be gentle and handling should avoid putting excessive strain on the hips, especially during bathing or trimming. Prevention of hip dysplasia is primarily through responsible breeding practices. Ensuring that breeding dogs have been screened for hip dysplasia can reduce the likelihood of passing the condition to offspring. Responsible breeders will have the breeding pair hip scored before mating. This entails X-rays being taken and sent to a panel of expert vets who will give each hip a score between 0 and 53, with 0 representing the least amount of hip dysplasia. Then, both numbers are added together to give an overall score out of 106. The average scores are around 9. Click on the link to view all the scores by breed in the UK on the Kennel Club database. Managing a dog's weight, avoiding overexercising puppies, and providing joint supplements early can also help reduce the risk of the condition developing. What causes hip dysplasia? The answer is, the main cause of hip dysplasia is genetic, and sometimes environmental factors can also play a role in the development of hip dysplasia, including rapid growth, obesity, and excessive exercise, especially in puppies of large or giant breeds. Poor nutrition during development can also contribute to the condition. Elbow dysplasia is a developmental joint condition where the bones in a dog's elbow, the radius, ulna, and humerus, do not fit together correctly. This leads to joint instability, pain, and arthritis over time. It is a common cause of front limb lameness in dogs, especially large breeds. The primary cause is inheriting it from parents. It can also be caused by the bones of the elbow growing unevenly, causing joint misalignment. Defective cartilage can lead to inflammation and joint wear, and high impact activity or excessive exercise at a young age can worsen the condition. Extra weight in obese dogs also puts more strain on developing joints. Symptoms can include limping or lameness in one or both of the front legs, stiffness especially after resting, reluctance to run, jump or play, swelling or pain around the elbow joint, difficulty standing up or lying down, and an abnormal gait such as holding the leg out to the side. Keeping the dog at a healthy weight to reduce joint strain can help. Vets may prescribe pain relief and anti-inflammatory medications. Joint supplements can support cartilage health. Avoiding high-impact activities is advised. Swimming is a good alternative to exercising on harsh terrain, and physiotherapy and hydrotherapy helps maintain mobility and strengthen muscles. In severe cases, surgery may be needed to remove bone fragments, realign the joint, or perform joint replacement. Only breeding dogs with good elbow scores to reduce genetic risk is advised, and feeding a balanced diet to support controlled growth in large breeds can help. Avoiding excessive running and jumping in puppies while their joints develop can help prevent the condition from developing, and maintaining a healthy weight to reduce joint stress. So what should a dog groomer do if they think a client is affected in the salon? Handle the dog gently and avoid putting stress on the front legs and support the dog when lifting. Use a non-slip surface to prevent slipping, which can worsen the condition. Keep grooming sessions short to avoid unnecessary discomfort. Advise the owner to see a vet if the dog is showing signs of lameness or joint pain. Modify grooming positions and allow the dog to sit or lie down during grooming if needed, but only if the dog wants to. Elbow dysplasia in dogs is caused by a bacterial infection and can be easily treated with antibiotics. True or false? The answer is false. Von Willebrand's disease is a genetic disorder that affects blood clotting. It is one of the most common inherited bleeding disorders in dogs. It is a genetic condition caused by a deficiency or dysfunction of von Willebrand factor, a clotting protein essential for platelet function in blood coagulation. Von Willebrand's disease is inherited, typically in an autosomal dominant manner, meaning one parent with the gene can pass it on to their offspring. Certain breeds, such as Doberman Pinschers, miniature Schnauzers, and Shetland sheepdogs, are more prone to this disorder. The condition develops when there is an insufficient amount of von Willebrand factor or when the factor is ineffective, leading to improper blood clotting. Symptoms can vary depending on the severity of the disease, but typically include excessive bleeding, bruising or nosebleeds and petechiae, which are tiny red or purple coloured spots on the skin that indicate hemorrhage of capillaries. Other signs include gums that bleed easily, prolonged bleeding from cuts, difficulty healing from injuries, and excessive bleeding after surgery or during heat cycles. In severe cases, spontaneous bleeding into joints, muscles, or internal organs can occur, leading to swelling or pain. The primary health risk of von Willebrand's disease is excessive bleeding, which can be life-threatening in some cases, particularly if the dog sustains a major injury or undergoes surgery. Without treatment, bleeding episodes may become more frequent and severe. In extreme cases, untreated bleeding can lead to shock or organ damage. Treatment often focuses on controlling bleeding episodes and may include blood transfusion, a synthetic hormone, and medications that help promote clotting. In severe cases, regular transfusions of plasma or platelets may be required. Dogs with von Willebrand's disease should avoid situations that might cause injury or excessive bleeding. In a salon, careful attention should be given to preventing cuts and bruising, and grooming should be gentle to avoid triggering bleeding. Prevention of von Willebrand's disease is primarily achieved through responsible breeding practices. Affected dogs should not be bred, and genetic testing of breeding dogs can help identify carriers of the condition. Early diagnosis and careful management can prevent severe bleeding episodes. What is the health problem caused by von Willebrand's disease? The answer is excessive bleeding due to problems with blood coagulation. Otitis is an inflammatory condition of the ear which can affect the external, middle or inner ear. The most common form in dogs is otitis externa, which refers to inflammation of the outer ear canal. Epithelial migration refers to the natural process in which the skin cells in the ear canal of dogs move from the inner ear towards the outer ear, helping to keep the ear canal clean by pushing debris out. Because of this, cleaning a dog's ears too frequently or unnecessarily can disrupt this natural process and potentially lead to irritation or infection. Ears should generally only be cleaned if there is a medical reason, such as an infection, buildup of wax, or an ear mite infestation. Overcleaning can cause damage or imbalance to the ear's natural environment, so it's best to clean them only when necessary and under the guidance of a vet. Otitis can be caused by bacterial, viral, fungal or parasitic infections. The most common cause is a bacterial infection, but it can also be due to yeast infections, fungal infections or parasites. Allergies, foreign bodies or anatomical factors such as drop ears can also predispose dogs to otitis. It's not contagious from dog to dog except in the case of ear mites, which can be transmitted from one dog to another. Otitis develops when the ear canal becomes inflamed due to the infection or other causes such as allergies, moisture, trauma or poor hygiene. Dogs with drop ears or excessive hair in the ear canal or those prone to allergies are more likely to develop otitis. Symptoms of otitis include ear scratching, shaking the head, redness or swelling of the ear canal, discharge which may be yellow, brown or bloody, foul odour from the ear, and sometimes pain evidenced by whining or reluctance to allow the ear to be touched. In severe cases, the dog may have a loss of balance and the ear may appear hot or swollen. Chronic cases may lead to thickened or scaly skin inside the ear canal. If left untreated, otitis can lead to chronic ear infections, pain and permanent damage to the ear canal and eardrum. In severe cases, it can cause a ruptured eardrum, inner ear infection or hearing loss. Recurring infections may also result in the thickening and scarring of the ear canal, which can make future infections more difficult to treat. Treatment often includes medication such as antibiotics or antifungal ear drops, depending on the underlying cause of the infection. If allergies are contributing to otitis, antihistamines or steroids may be used as well. Dogs with chronic otitis may need regular ear checks and cleaning with specialised ear cleaners if required. At home, owners can manage otitis by keeping their dog's ears dry and clean, especially after swimming or baths. In a salon, dogs should only have their ears cleaned if necessary, and you should avoid any harsh handling or use of unsafe products. If there is an active infection that's quite bad, grooming should be postponed until the infection is resolved due to the pain and exacerbation of the symptoms. To prevent otitis, clipping the hair around the external canal can aid airflow, and regular ear checks can help as well. Cleaning with appropriate products to help remove excess wax and debris around the outside of the ear canal can help, but only if necessary. If the ear looks clean, it should be left alone. Keeping the ears dry and avoiding moisture accumulation is important, and for dogs prone to allergies, managing their allergies may help prevent otitis from developing. Ensuring that dogs with floppy ears are groomed properly and that the hair inside the ear canal is plucked can also help reduce the risk as well. Otitis caused by bacteria or a virus is not zoonotic. When ear infections have been caused by parasites like ear mites, it is possible for the mites to spread to humans via close contact, but it is very rare. You should clean a dog's ears regularly to prevent otitis. True or false? The answer is false. Canine seasonal illness is caused by harvest mites and is also known as chiggers in the US. These tiny mites cause dermatitis, which is skin inflammation, in dogs, especially during certain times of the year when they are most active. Canine seasonal illness is caused by the harvest mites and is a disorder that leads to skin irritation and itching due to reaction to the bites of the harvest mite larvae. Harvest mite infestations are parasitic in nature. The larvae of the neotrombicular or autumnalis mites bite and feed on the skin of the dog, causing irritation and inflammation. Harvest mites are typically found in grassy or wooded areas, especially during late summer and early autumn. The mites attach to the dog's skin when they walk through infested areas. The larvae feed on the skin for several days before dropping off. They are not contagious between dogs, but can be spread in areas where multiple dogs have access to infested environments. Symptoms of harvest mite infestations include severe itching, often in areas like the feet, belly, ears, or around the eyes, red inflamed skin, crusty or scabby patches, bald spots due to constant scratching or biting, swelling in the affected areas. Dogs may also be seen licking, biting, or rubbing the affected areas due to the intense itching, or you might see the mite larvae attached to the skin as shown on the next slide. If left untreated, the constant scratching and irritation caused by harvest mites can lead to secondary bacterial infections, hotspots, or skin damage. In severe cases, the dog may develop an allergic reaction to the mite bites, leading to further skin complications. Seasonal canine illness can be fatal to dogs if left untreated, but it's often not if treated early. Treatment typically involves prescribed topical treatments such as anti-itch creams, sprays, or medicated shampoos to soothe the skin. Oral antihistamines or steroids may be prescribed by the vet to control itching and inflammation. Some topical spot-on treatments are also effective at killing harvest mites. Regular bathing with soothing shampoos to remove mites and alleviate itching can be advised by the vet. Preventing further exposure by keeping the dog out of infested areas, especially during peak harvest mite seasons. In a salon, grooming professionals should be careful to avoid causing further irritation when handling dogs with mite infestations. Advice should be sought from a vet before grooming a dog with harvest mites, and then they may be bathed using appropriate treatments and gentle techniques to soothe the affected areas under the vet's guidance. Preventative measures include keeping away from grassy, wooded or overgrown areas where harvest mites are most prevalent, regular use of topical flea and tick preventatives that also target harvest mites, frequent bathing during mite season to remove any mites before they can cause irritation, keeping the dog's coat well trimmed and clean to minimize mite exposure. Humans can be affected by harvest mites if they come into contact with areas where the mites are active and may experience irritation or dermatitis, but this is typically mild and transient. The mites don't move from animal to animal, they are picked up from the environment. Harvest mite infestations are primarily seasonal and geographically influenced, with outbreaks commonly occurring when environmental conditions are ideal for mite larvae to thrive. When are harvest mite larvae typically active? The answer is late summer and early autumn. Go to our website and click on resources to find these flashcards for free. Use them to revise and test yourself. Here are some questions to help get you started.